Hi, I'm Gail Costello, and I'm your Green Party candidate for the Oromocto-Lincoln-Fredericton riding. We have a couple of questions today for David Coon, starting with, how is it that the Green Party will support the military?
Well, there's a fine military tradition in my family. My grandfather and his brother both fought in all the major battles in the First World War, and their cousin gave his life there and is buried in France. My uncle Bill was in the military during the Second World War, and his cousin gave his life over Germany. His bomber was shot down over Nuremberg. One of the things that has changed in recent years that I find appalling is the cuts that have been made to support for our veterans. And not just the cuts, but the attitude that has underlined those cuts to the budgets. I recall very well how members of my family who were veterans in the past were treated before this sea change happened. And they couldn't have been treated better. Anything they needed, they got. They were respected and they were taken care of. And that's not been the case for some years now. And I want to see that change. Now, it's a federal responsibility, that's true. But I have a great working relationship, as does Gail Costello, with our Member of Parliament, Jenica Atwin. And I know Jenica Atwin feels the same way. So we will work with Jenica and her colleagues in Ottawa to make sure that we restore that respect of our veterans and the funding that's necessary to provide the needs and support our veterans after their service. It does require an attitude change, but I think we can do that, and we need to do that. And I'm prepared to work with Jenica and Gail to help make that happen.
Another question that's come up is about specifically, I guess, Oromocto First Nations, but the different First Nations across the province with regard to a plan to reduce tax credits. This is something that they are quite upset about and are wondering how the Green Party can help them in this area.
So there's been a long-standing practice around the tax arrangements with First Nations to enable First Nations to get ahead. And it's made a big difference. You can see the economic development, the local community development that's happened in First Nation communities as a result of the tax arrangements that have been in place in more recent years. It's been very helpful, and we'd want to see those continue and be available to all First Nation communities around the province. So the proof is in the pudding. You just have to visit a community today compared to say 15 years ago, and you can see the economic development that's happened as a result of these tax arrangements and some of the other changes that have occurred on the First Nations and within the leadership.
The next question is around your wanting or promising to raise minimum wage to $15 an hour. I've received questions saying, how is that going to happen? What is going to get cut? I'm a small business. I'm not going to be able to afford to handle $15 an hour. And so I'm just wondering how you might respond to that.
So we have way too many people making a minimum wage that you can't live on. And during COVID, the beginning of COVID, we saw our grocery stores, for example, bump up people's wages by $2 an hour. So we would move our minimum wage to $15 an hour, which is still well below a living wage, which would be closer to $20. But it would start with a $2 increase, $2 an hour increase, just as was done during the beginning of COVID. It's absolutely essential for people to have that to live on. If there are businesses, small businesses that are locally owned that cannot afford that during this period of COVID, then our government would provide financial support by way of payroll rebates to ensure that they could. It's not fair for people working on a low level of minimum wage to essentially be subsidizing the company they're working for, because that, in effect, is what is happening. If a small company needs that help, it makes much more sense that as a government, we support them rather than them being supported by lower wages on their employees.
The other question was, and I guess everybody's asking the same question, this is not just something that affects them, but the doctor shortage?
So I've done a lot of work to try and understand why we have a doctor shortage, talking to the New Brunswick Medical Society, talking to the Department of Health, talking to Horizon Health Network managers. And one of the things that's clear is the way the province has been approaching doctor recruitment is terrible. And we need to totally up our game there. We have a great story to tell about the incredible quality of life we have in New Brunswick and in the greater Fredericton area here, and we're not telling that story. We're not aggressively recruiting doctors as we should. We should have people out there across this country actively recruiting doctors to come to New Brunswick to be part of our communities here, and let them know about the kind of quality of life they can expect to raise their families in. So one of the first things that's be so important is to really transform the way we do doctors recruitment. And you can sort of see why that might be happening, because Blaine Higgs tends to be a little negative when he talks about our province. And for Greens, we're full of hope about the future of this province, because we have heard the great solutions people have had in every corner of this province to move our province forward in a positive way, and we've got a great plan to do that. But we need to be more positive about the future for New Brunswick, and that then will be transferred in all of our efforts outside of our borders to do things like recruit doctors and recruit nurses as well. So that's one thing. The other thing is, of course, many doctors and younger doctors now are looking for the opportunity to work in team-based practices where they've got some life along with their profession, so a better work-life balance. And one of the fundamental healthcare reforms that we would implement is to move from solitary doctors working all by themselves and being the only sort of gatekeeper to the healthcare system for you, to team-based practices, many of them situated in community health centers, to ensure that both the doctors and nurse practitioners have a reasonable life as well as their career, and that you as patients have access to a team of people who are looking after you, so you don't necessarily on every visit have to see the doctor, see the nurse practitioner. Maybe it's a dietitian, maybe it's a counselor, maybe it's a physiotherapist, but that there's a team who are your care team. And that's a different way than we've been doing it. So instead of having a single doctor or maybe a single nurse practitioner as your caregiver, you have a care team. And that would fundamentally change the situation now and would really end the long waiting list for having a primary health care provider.